गुड इवनिंग एवरीवन। वेलकम बैक टू माय चैनल। आज मैं पहला वीडियो बनाने जा रहा हूँ फार्माकोलॉजी के ऊपर। तो बेसिकली मेरा नाम शाहिद अली खान है और मैंने मेरा एम फार्म फार्माकोलॉजी किया है। तो मैं आज से हर दिन एक फार्माकोलॉजी का वीडियो में बनाने वाला हूँ और उस वीडियो में मैं आप लोग को मेरे फार्माकोलॉजी का जो भी मेरे पास नॉलेज है वो मैं बुक से पढ़कर आप लोग से मैं शेयर करूँगा। और एग्ज़ाम पॉइंट ऑफ व्यू से हम लोग को क्यों चाहिए, कौन सा हम लोग का मैकेनिज्म पढ़ना है, इसके बारे में हम लोग आज पढ़ने वाले हैं। तो सबसे पहले हम लोग शुरू करते हैं कि जो व्हाट इज़ फार्माकोलॉजी। तो सबसे पहले हम लोग को ये पता करना है कि हम लोग कोई भी एक मेडिसिन खाते हैं, उस मेडिसिन का मतलब दो चीज़ होता है। एक होता है क्या ना, हम लोग का कुछ थेराप्यूटिक्स एक्टिविटी होता है और उस एक्टिविटी में हम लोग को क्या कर पता चलता है कि जो हाँ इस दवाई के अंदर हीलिंग का कैपेसिटी है। और दूसरा होता है कि उस दवाई जो हम लोग खा रहे हैं वो बेसिकली केमिकल मोइटी रहता है, केमिकल कंपोनेंट रहता है और उस केमिकल क्या करता है ना कुछ टॉक्सिसिटी हम लोग का प्रोड्यूस करता है। क्या टॉक्सिसिटी प्रोड्यूस करता है? मान लो कि जो आप अगर मैं एक एग्जांपल दूँ कि आप मतलब कोई भी एक दवाई मतलब ज़्यादा खा रहे हो। मान लो कि जो आप पैरासीटामोल आप ज़्यादा खा रहे हो, तो पैरासीटामोल का हम लोग को एक चीज़ पता है कि जो ये क्या होता है ना, ये हम लोग का एनाल्जेसिक होता है। एनाल्जेसिक का मतलब जो हम लोग का बॉडी का पेन रिलीव करता है उसे हम लोग एनाल्जेसिक बोलते हैं। और उसके साथ साथ क्या होता है, पैरासीटामोल हम लोग का एंटीपायरेटिक्स होता है। एंटीपायरेटिक्स का मतलब क्या होता है कि जो हम लोग का बुखार, बॉडी का टेम्परेचर जो होता है वो जो हम लोग का घटाता है उसे हम लोग बोलते हैं क्या, एंटीपायरेटिक। तो एक चीज़ तो हम लोग का कॉन्फर्म हो गया है कि जो पैरासीटामोल जो होता है, पैरासीटामोल का एक मेडिकल यूजेस है कि हम लोग का बॉडी का जो मतलब टेम्परेचर उससे रिड्यूस करता है। इवन इट ऑल्सो रिलीव आवर बॉडी पेन ऑल्सो। सो ये दो रिलीव करता है। लेकिन हम लोग अगर पैरासीटामोल ज़्यादा यूज करें तो हम लोग क्या होता है, हम लोग का हेपाटोटॉक्सिसिटी हो सकता है। हेपाटोटॉक्सिसिटी का मतलब क्या होता है, जो हम लोग का जो लीवर होता है, लीवर का फंक्शन क्या हो सकता है ना, लीवर का फंक्शन हम लोग का डैमेज हो सकता है। मतलब लीवर बेसिकली लीवर का जो मतलब सेल होता है तो उससे डिस्ट्रक्शन होता है। तो एक चीज़ तो हम लोग को पता था कि जो हाँ कि जो पैरासीटामोल जो होता है वो एक ड्रग है। ड्रग मतलब कोई भी चीज़ हो सकता है। ड्रग मतलब कोई भी एक चीज़ जो हम लोग का बॉडी में हीलिंग देता है। वो आपका सिंथेटिक हो सकता है, मान लो कि जो केमिकल प्रोसेस से बन रहा है वो हो सकता है, या आप नेचुरल सोर्स से भी हो सकता है, या आप मान लो कि जो कोई भी सोर्स हो सकता है जो हम लोग का बॉडी में क्या ना हीलिंग कैपेसिटी देगा। लेकिन फार्माकोलॉजी पढ़ने का मेन ऑब्जेक्टिव यह है कि जो हम लोग कोई भी एक ड्रग जिसके बारे में हम लोग को ये पता है कि जो हाँ इसका यूजेस ए होता है। मान लो कि जो हम लोग एंटीबायोटिक खाते हैं तो हम लोग का क्या करता है ना, वो बैक्टीरिया स्टैटिक्स या बैक्टीरिया को मारने में हम लोग का मदद करता है या बैक्टीरिया के ग्रोथ रोकने में मदद करता है। और मान लो कि जो हम लोग जो मतलब कोई भी मतलब पेंटोप्राजोल खाते हैं, कोई भी हम लोग मेडिसिन खाते हैं, उसमें हम लोग क्या कर पता चलता है कि जो हम लोग का एसिडिटी रोकता है। लेकिन फार्माकोलॉजी का मेन ऑब्जेक्टिव क्या है, वी शुड रीड अबाउट द यूजेस इवन दैट पर्टिकुलर ड्रग ऑल्सो प्रोड्यूस सम काइंड ऑफ द like adverse drug reaction. I mean, whenever you are taking some kind of medicine, it also produce some kind of like side effects. You need to read about those things also. So that's why this pharmacology is not about only the uses of medicine, but you should more concern about the like toxicity, like the side effects. That's why this subject name is the pharmacology and toxicology. So basically we need to read about, basically pharmacology means in this subject basically so many drugs will be there. That drugs may be like few drugs will be there which will reduce your hypertension. Few drug will be there, they will like increase your like blood pressure. Few will be there which will reduce your acidity. There will be so many different classic means drugs will be there. In that particular drugs, what we are going to do, like we have to read about the what is the like uses of that drugs. Even we should more concern about that what is the side effects of that particular drug. So this is the subject that is called as the pharmacology. So the pharma means the medicines, and that about knowledge, that ecology, right? So you have to know about the knowledge about a drug, means it's include the uses, even it's include the side effects also. Like whenever like the drug is being discovered, like if you see the history, the most of the drug, they are what na, they are chemical in nature. So it will show the uses, even it should not show the more toxicity. So then only what will happen na, we can consider that drug as the drug. Either we can consider if the toxicity level is high, that time we can consider that dose, like that drug as the like poison, right? So the therapeutics value will be the high. If the therapeutics is high, then only we can consider that. If the lower will be the toxicities, so we can consider that drug as the drug. So let's start. So basically, if we means further, we are going to read about the pharmacologies, like many classifications, like in the anthelmintic classification. Then we read about the antipyretic, then antibiotic, then antacid, then means neoplastic drug. There's so many different drugs like about. So we are going to read about those drugs. But the basic fundamental of this subject is that we have to know about the two basic things. The two basic thing is that about what na, one thing is the pharmacodynamics, thermodynamics, and the another one is what na, pharmacokinetics. So the dynamics part is like if someone will ask like what is the main branches of pharmacology, or the what is the main two principles of pharmacology, you can say that is the pharmacodynamics one thing, and another one is what na, pharmacokinetics, right? So let's start with the dynamics. So in the dynamics part, thermodynamics, what we have to know is that like what drug does to the body, right? Suppose if you are consuming a drug, right? Your main purpose of consuming a drug is that like it should cure your body problem, right? This is the first thing. And it's the study about the drugs, like how the drug will going to act in our body. Suppose if you are consuming a drug, maybe like so many different drugs are there, and if you see every drugs has the different mechanism of action in our body. Like few will reduce the enzymatic reaction, few will activate some kind of like enzyme, few will reduce some kind of pre-synthetic parameters. So this is the thing. Like the thing is that in the thermodynamics, we have to know about the what is how the drugs will going to act in our body. The first thing, and every drugs has the different pattern. Like if you are taking a medicine for the for antacid purpose, so that time what will happen is in which mechanism it will going to reduce our like over HCl production from our stomach, right? So what all mechanisms are there? Does it inhibit by using the like proton pump receptor, or what is the main mechanism of that? So that will stand for the pharmacodynamics, means the every individual drug has some different kind of mechanism. By base of that different mechanism, what will happen? Now the body will produce, it will give the response towards that drug, so that our body will be healed. So how this like healing process is occur after taking that drug is considered as the pharmacodynamics. Like means the basically what drug means an external thing, that drug, what it will going to happen whenever we are taking that medicine, right? That is called as the pharmacodynamics. Means what basically the drug will do to our body. So we can say that in which mechanism that particular drug will show action or give us the healing. That is about the pharmacodynamics. Another major branch is that is about the pharmacokinetics. In the kinetics parts, what is there? In kinetics, see here we need to know that what There it was in the dynamics part what drug does to the body. Here what body does to the drug. So in here basically what is happening here, suppose if you are consuming a medicine, right? So how the body will react to that drug? I mean, like what is the body physiology will change whenever the medicine will go inside our body. What will changes? What will occur in our body? First thing is that whenever I'm taking medicine, after that what? Now it should be absorbed, right? Where it will absorb, it will go to our like stomach, right? Then what will happen, like it will distribute. Where it will distribute, suppose I am taking a medicine, after that our stomach will produce the HCl, and after that it will become more fragmented. After that, that more fragmented will go to our systemic circulation through where, through our maybe our like small intestine, that there is the zone where like maximum dose are go inside our like into the, it will get enter into the systemic circulation. So the thing is that, like what is the physiological changes whenever I'm taking the medicine? First thing will happen what? Now it will go to our stomach, right? So after that what will happen, it will going to fragment it. After that the fragmented part will go more fragmented, means it will become powder or it will convert into the very small particles. After that it will reach to the small intestine, or through the intestine like mechanism it will get entered to our systemic circulation. Once it's entered in the systemic circulation, what will happen, it will go to our like target area. Suppose if I'm taking a medicine for like heart, so it need to go to our heart, right? So if I'm taking a medicine for a liver, so it should go to my liver part. So through the help of the systemic circulation, means blood circulation, those drug will go to that particular area, like maybe heart, maybe the liver. And after that what will happen, like it will show some kind of action. So whenever like if you see, like whenever I'm taking a medicine, after that it is going through 3-4 process. That 3-4 process is that first is absorption, then what, then distribution, then what is happening, then metabolism, then what is happening, the excretion. See, after a medicine, like after we consume a food, so the waste will going out, right, after one day. So the thing is that it's not exception with the medicine also. After completion of its purpose, the medicine should excrete from our body. So it may excrete through the urine, or it may excrete through the like sweat, any mechanism it may excrete, right? So the thing is that, like in the dynamics part, what is there in the pharmacodynamics, that what drug does to our body, that drug what will, like it will, what it can give to our body. First thing is that, like it will heal our body, right? So healing, whenever healing is happening, so what will happen now, what is the mechanism of action, or in which way it has capacity to cure my disease, so that called as the pharmacodynamics part. And in the pharmacokinetics part, what my body does to the drug, like whenever I'm taking a medicine, so my body response toward that drug is what? First is what? Now it will go inside my body, means the body will accept that. After that it will go to our stomach, and after that it will become more fragmented, and after that it will mix into the systemic circulation. After that it will reach to the desired location where, like in which purpose I am taking that medicine. And after that what will happen, now after completion of its purpose, so it will excrete out from our body. So this is the basic branches of the like two thing. One is like pharmacokinetics and one is pharmacodynamics. So in dynamics part, we need to know is that in the dynamics, pharmacodynamics, okay, the pharmacodynamics part, what is happening now? What drug does to the body? So what drug does to the body? Basically it produces the healing. So how healing occur? Healing occur by mechanism, right? And in the pharmacokinetics, what is occurring here? What body does to the drug, right? So this is the basic difference. And here what will happen? Here absorption will come, then distribution will come. Absorption in the sense, whenever I am taking medicine, it will, like what body does to the drug means, it will, in the dynamics, it will show some mechanism action so that our body will get healed, right? And in the pharmacokinetics, what is happening? Like whenever I am taking medicine, is when by the time when our like tablet is entering inside my body, so what is happening? First my body will like absorb that, okay. After that what will happen? Like that more that tablet, if you are taking the tablet, right, so it will become the more fragmented. Fragmented means it will become like convert into the more smallest particle. After that what will happen? It will go to the systemic circulation. Systemic circulation in the sense is that from the intestine to the systemic circulation, to the systemic circulation, right? So after that what will happen? It will reach to the desired body part, or you can say that receptor, that we will going to know in the later video. And after that what will happen? Now it will show like after that, after fulfilling its purpose, it will excrete from where? Now excrete from our system, means from our body. By what? Now by urine or by the sweat, like the excretion, like the after it does it work, it will remove from our body. So that is about the excretion. And one part in the, like in after absorption, distribution, then we have another part also, that is called as the metabolism. In the metabolism part what will happen? Now basically in metabolism part, like if some kind of medicine, if that is not what the solid, basically it need to excrete from our urine, right? So basically all the drug at the like it should be water soluble, because it need to like remove from our body through the urine. So what will happen in the metabolism part? There will be the many purpose. First is that like if there's like if suppose if you consider a structure, right? So in that structure, if this part is what? Now this part is non-solvent to what? Now non-solvent to water. That time what will happen? In the metabolism part, like by the help of so many different enzymes which present in our body, what will happen? This particular thing will be the change, means the non-solvent will convert into the what? Na solvent to what? Na solvent to water, so that it can come out from the urine. This may be the one purpose. Or another purpose is maybe for the mechanism of action, our metabolism is also required. If the metabolism will not occur, the MOA will be not occur. So basically the metabolism is the step where the all drug activity will be shown, and maybe further modification or further mechanism just happen at the metabolism position. After that, in the excretion, the drug will come out from our like urine, in stool, then in the sweat. So this is all about the basic thing of the pharmacology, and basically we need to be more concerned about the like toxicity, what is being produced from the like that from the that particular dose. We need to know about those things, right? So pharmacology is all about like what is the uses of drug, and by the time we need to know about the what is the toxicity of that drug, and what is if the some cases what will happen if the like overdose happen. So that time what medicine we can keep in order to be like make the situation under control. So this is all the thing we are going to know about in the pharmacology in the later video. So basically the pharmacology, all medical professions should read. Is like be pharmacy student and physiotherapy student, all students need to know about the pharmacology. This is the thing where like the uses of drug we are going to know, right? So thank you for watching. See you in the next video.